I take you back to this now. October marks Cancer Awareness Month as organizations such as Gift of the Givers, as well as the Cancer Association of South Africa, has embarked on a campaign to bring awareness. Today, they had painted the Sea of Muizenberg Beach quite pink. Lorraine Govender is the National Manager for Health Programs at CANSA, and she joins us now. Lorraine, good evening. Thank you so much for your time. Really do appreciate it. For the most part, death by breast cancer is to an extent preventable, particularly if early detection becomes the norm in South Africa. Are we getting early detection practices right?
Definitely. So the fact that we are seeing more breast cancer cases being registered by the National Cancer Registry, definitely the awareness is there, and we are finding more people coming in with breast cancer. However, the big problem is the stage of diagnosis is a huge challenge that still exists in our country.
And perhaps to speak about the stage of the diagnosis, is it because of when the diagnosis or the detection takes place? Is there a difference between how severe the cancer might be if it's detected early into the life cycle?
Absolutely. So there's different stages of cancer. And often we find that when our women do come in and there is a diagnosis of breast cancer, it's usually in the late stages. So so when breast cancer is diagnosed late, you'll find that it definitely affects the quality of life for women. So where you would be able to just maybe do a biopsy and give early treatment if it's in stage 1 or stage 2, it's easier to treat. However, in stage 3 and 4, the cancer has usually spread to, into your auxiliary glands and into other parts of your body, which makes it more difficult for the doctors to treat. So that's why we really urge women, to do the self-breast examinations and to have their tests done. And most of the time, it's very difficult in our country to really go in for routine mammograms. It's very, very difficult. It's not accessible. It's only when you have symptoms and you present with symptoms that you would have further investigations. However, many women, we don't want to say women should lose hope because mammograms are not easily accessible. But we want to encourage women to do self-breast examinations so that when they do pick up the lump, most of the cases, when a woman picks up a lump and they go into a local clinic, there definitely are further investigations that is available to the women to diagnose breast cancer. So really, there is hope for women in our country, but the important thing is to go and have yourself checked when you do pick up the lump. And that is the challenge. Women don't go and seek medical care once they find that they have a lump. And that definitely affects their quality of life.
Yeah, I mean, how common is it that women do feel a lump and think it's probably just benign?
Yeah, so it's not even the fact that they think it's benign. It's more the fact that they feel they already start diagnosing themselves. They're afraid to go. It's the fear of the unknown. And, there's so many myths around and so much of stigma attached with cancer as well as breast cancer that women often, when they do pick the lump up, they just don't go for medical treatment. And we live in a culturally diverse society. And when something goes wrong and women pick up that there is something wrong with them, going to a healthcare provider is not always the first line of treatment. There's other things that people will do before they do go in to have themselves checked for that lump.
You say more cases are being registered, which is a good sign, which means more detection is taking place. But how many more cases are we talking about? What's the trend line showing?
So it still exists that 1 in 27 women in our country have breast cancer. So that means when you look around and you're in a room full of 30 people, at least one person in that room would have had breast cancer. So it's still the most common cancer affecting women in our country. So the good thing, the fact that we are picking up more cases means that, people are going in, they are having the checks. But again, I want to stress the stage at which the cancer is being detected is a concern. And it's just not only about women going in after they find the lump. We also find that there's a lot of long waiting periods for the mammograms, which is usually the test to pick up, whether that lump is a problem. We don't have enough equipment in our country to really detect and to have more diagnostic tests done in order to detect that lump and to do more investigations to find out whether it is cancerous. That is also another challenge that exists.
Yeah, well, we're going to have to leave it there. Thank you so much for your time this evening, Lorraine. Really do appreciate it. Lorraine is the National Med Programs Manager for CANSA.